Welcome to another episode of Living Well in Montana. Living Well in Montana is a production of Living Independently for Today and Tomorrow, colloquially known as LIFT. With offices in Billings and Glendive, LIFT is the Center for Independent Living for 18 counties in southeastern Montana and is committed to providing programs and services to help empower persons with disabilities to break down the physical, bureaucratic, and cultural barriers that prevent them from being fully independent participants in their lives and communities. My name is Jed Barton, and I am privileged to be the Outreach and Government Affairs Coordinator at LIFT. And alongside me today is co-hosting is Kathleen Benoit. Now we'll introduce our guest. Too often, parents of school-aged children with disabilities are overwhelmed by the bureaucratic intricacies associated with the public education system and need assistance, guidance, and advocacy to ensure their child gets the services to which they are entitled so they can succeed in the classroom. Our guest today, Tom Lynaugh of the Montana Empowerment Center, is one of the people that Montana parents can turn to when they need a little help, and we welcome him to the program to talk a little bit about the Montana Empowerment Center and navigating the system as a parent of a child with disabilities. Welcome, Tom.
Thank you, Jed. Thanks for having me.
So Tom, just briefly, what is the Montana Empowerment Project, and what services do they provide to parents, students, educators, and schools across Montana?
The Montana Empowerment Center is federally funded by the Office of Special Education Programs. And under the special education law, the Individuals with Disabilities Education Act, which is the short term is IDEA, requires each state to have a Parent Training Information Center, a PTI, and we are that Parent Training Information Center. We took over the grant that PLUC had. I think a lot of viewers might be familiar with PLUC.
And that was Parents Let's Unite for Kids, correct?
That's correct, yes. And we perform basically the same services as a Parent Training and Information Center. We support families with children with disabilities in their education programs. We try to impart information to parents that help them with the process, understanding the terms. As you mentioned briefly in the beginning, it's kind of an intimidating process, and it's got a language of all its own. So we help with that. We support parents. We give individual assistance. If a parent is going to an IEP meeting, we talk to them about the IEP, the Individual Education Plan. And if they go to the meeting and then come back without signing it, we look at it again and make sure that it's everything that they, and we talked about, that they want in the plan for their child. Part of our goals for our grant is to work on transition of post-high school, and we work with parents that have children that are under the law. At age 16, you have to have a transition plan in the education plan. Mm-hmm. And it can start earlier at age 14 if the individual education team decides that individual would be better served by preparing for life after school. And that may be an individual who needs assistance in budgeting or life skills, or simply, just getting around.
Can I jump in real quick? I know I have a little mic problem, so I'm going to say this loudly.
Okay.
It must be difficult for teenagers to comply sometimes because they have a mind of their own when they are getting prepared for a transition, and so that must be a whole different ballgame as opposed to a grade school child and the plans.
It can be. One of the requirements for a youth going through transition is that they come to their meeting, or they're invited to their meeting. With a younger child, sometimes what happens is the parent decides that it might be better not to have the child at the meeting because the meeting might get a little contentious. And what we've done in that situation is we've gone through the meeting and then invited the child in so that the child can see that everybody's on the same page, and that that really goes a long way toward working.
Again, it's interesting you mentioned transitions. Again, with our federal funding and contracts on one of our core services through the is youth transition for youth with disabilities to transition to employment or higher education. So again, that is an area where our agencies hopefully can collaborate. How did you get involved with Montana Empowerment?
My wife and I have a son who went through the special education process, and this was probably in the early 90s, and he was learning disabled and qualified for special education. I mean, both my wife and I were well educated, but all of a sudden we were confronted with this new situation, a new language. We'll talk about individual education plans, but they're at least 8 pages long, and they have different sections in them. And so we went to Pluck at the time, and one of the support people at Pluck came to the meetings with us and gave us information and made us more knowledgeable. One of the things that MEC is trying to do, and that Pluck did, is make allow the parent, enable the parent, empower the parent to be able to participate fully in the meeting, because the parent is part of the team that decides the individual education plan. And the more information they have, the more effective they can be.
So you're empowering both the child and the parents.
Correct.
That-
Correct.
That covers a lot of ground.
And
at some point, some people feel so hopeless.
And I think part of the support is to help the parent and the child understand the nature of the disability and how they can go forward with the best plan.
You mentioned the Individuals with Disabilities Education Act, or the IDEA, and that certainly plays an important role in defining the rights and responsibilities of districts, schools, families, students with regards to receiving an education while disabled. Can you talk a little bit what IDEA requires and perhaps some of the common misconceptions surrounding the law?
Well, I think IDEA requires that there be an education plan designed for the individual. Looking at the individual, what the individual's skills are, what the individual's needs are, as opposed to just looking and focusing on the disability itself. And so as part of that, I've talked about the IEP, the Individualized Education Plan. The major part of that is 2 sections. One is called the present level of academic achievement and functional performance. And the second section is goals. But the second section really can't be effective unless you have the present level of the individual, the child, academic achievement, what are they capable of doing academically, and what's their functional performance. And it may be that a child has levels in both that are below his or her peers, and so the IEP would focus on that, meet them at the level they're at, and provide a goal that would allow them to improve from that level and go forward. An example would be a 4th grader, perhaps, who has a learning disability in reading and can only read at the 2nd grade level. So that person would be given the opportunity to get special instruction in what they call the resource room or the special education room, where they would be able to work on their reading and advance their reading, say, from second to third grade level, or if, and it should be identified in the present level, what their problem is. Is it fluency? Is it comprehension? And then they would work on that to improve that and get it to the next level.
A little bit of, to interject a little bit of my personal history here. I spent a fair amount of time as a second and third grade in the resource room of Hanover Street School in Lebanon, New Hampshire, trying to be taught cursive. So again, with my cerebral palsy, with my motor skills, so yeah, and again, the folks were great. The OT and the PT were great, and it was part of my IEP at the time, and it was what my classmates were doing in class. So yeah.
Well, in this day and age, there's a lot more options available. If we see a child that's struggling with handwriting or being able to write at all, why not, start them on keyboard at an early age.
And to the credit of the New Hampshire and later the Billings Public Schools, that's exactly what they did with me. I was typing before my classmates.
But that's part of the individualized focus that the IDEA does. As far as misconceptions go, I think one misconception is that special ed students have to be taught in a separate room, separate from their peers in the regular education classroom, and that's not true. One of the purposes of the IEP is to provide accommodations so that that individual can go into the classroom and be with their peers in the third or fourth grade or whatever grade it is. And if they need teacher notes, if they need to be seated closer to the instruction, if they have a habit of if they have behavior issues, if they're able to take a break, and then come back in. Really, one of the terms that talked about in special education is the least restrictive environment and inclusion. And as much as possible, the individualized education plan is designed to have that individual do as many regular education classes as they can. And like our example with reading, if they have to take an hour out and work on reading, then that would be part of the plan as well. Another major misconception, and I think this is something that we've worked on at MEC, is that parents go into IEP meetings, they see this 8-page or 9-page document that's been prepared by the school, and they think, well, I guess that's it. I guess that's something I need to sign. And what we're trying to do at MEC is make people more aware that they can look it over, they can take it home, they can think about it, they can call us, and just make sure that their thoughts and input have been adequately considered.
Yeah, that's very much in line with the philosophy we have as a Center for Independent Living at LIFT about the consumer, or in this case, perhaps, especially with younger children, the parent, are as one of my colleagues would say, is driving the bus. So yeah, that's
another misconception that we've worked with parents on is they're concerned about being labeled special education, that there's something negative about that. And one of the categories that you qualify under for special education under the IDEA is emotional disturbance, that you have, an emotional problem that requires specialized instruction. And we try to explain that, and a lot of students that start out early on IEPs are able, if it's attention disorder, ADHD, they're able to get help. And in my experience, a lot of children transcend the IEP and they go on and become productive. I just had young man I worked with several years ago with Pluck who has got a full ride scholarship to Stanford University.
Wow, that's impressive. Do you notice any particular trends in the work that MEP is doing, both positive and negative, about how students are being educated in Montana public schools with students with disabilities?
One of the important things in my view that have taken place over the years that I've worked with these organizations is that now the school districts, most of the school districts provide the parent with a draft of the IEP prior to the meeting. It used to be that the first time the parent saw it was right at the meeting itself. And then the other thing is what I had mentioned earlier, and that is we tell the parents that if they have any questions about the IEP, it goes fast. I mean, teachers, my daughter's a special education teacher, and she tells me from her perspective, she has several IEP meetings a week that she has to prepare for. And so, you know, she needs to get the work out, she needs to get the IEP written, and, you know, from their perspective, they want to get it signed as soon as possible so that they can implement the changes that have occurred in the IEP. And but from the parent's standpoint, it goes too fast. And rather than sign it if they have any doubts, take it home and read it, and they might see something that, you know, that doesn't fit right or that they want to expand on, and you can go back and have another meeting and do that.
And to their credit, most of the educators I know, you know, are grateful for parents who are involved and you know, take the time to care about what happens to their child at school. It's
Two of the things that probably fall more into the negative category. The parents are presented, the parents have certain rights, procedural rights that we try to explain to the parents. If they make a request, one of their rights is to have the response in writing. It's called prior written notice. They're entitled to look at their students' records. They're entitled to consent to the IEP. In Montana, if the parent doesn't consent to the IEP can't be implemented. There's also the option of the parent to sign with exceptions so that they can take the IEP and say, well, the reading goals are okay, but I'm not sure about the math goals. And so I'm going to say I approve the reading goals, but we need more discussion on the math goals.
I want to jump in just quickly with the Montana Empowerment Center. Let's say someone's watching this program and they've never heard of this. What's their first step? You would think maybe educators would say that there's help here, but sometimes you'd be surprised.
Some do. Some educators do. I mean, I think that we have a fairly good reputation across the state, and you know that people know what the organization does, and so they do suggest it at times, but Montana's a big state, and there are a lot of small rural school districts, and you know, getting the word out to them is something we're trying to do through our website, montanaempowermentcenter.org. We're on Facebook. A lot of information about some of the terms we've mentioned today, the least restrictive environment.
A phone number? Is there, if someone's just at their wit's end and didn't know about this, is part of the center here? Is it a physical building here, or
we don't have a physical building in Billings. We do have an office in Great Falls. There are two of us, myself and Sandy Taylor, who work out of our homes here in Billings. Our director is in Great Falls. Her name is Rebecca Richards, and then we have two other. We have Jean Schrader and Cindy Koenig up in the Great Falls area. We cover the entire state. And I haven't memorized our toll-free number, but
that's all right.
It's 1-877-870-2633. 877-870-1190. 877-870-1190.
And I believe it is being shown on the screen at this time as well.
Yes, it
So,
is.
Okay.
That's great. Again, obviously there are rules of confidentiality and whatnot, but could you talk us through a regular sort of intervention or interaction that you have with a parent? I mean,
Okay. Somebody either writes into our website or calls and says, you know, my son is in the 3rd grade, and he's being sent to the principal's office 3 or 4 times a week because he disrupts class, or he's talking to his classmates, or he blurts out answers and doesn't raise his hand, and it's very disruptive to the teacher. And we get as much information as we can, and we say, it may be, we would suggest that you ask for an evaluation for special education. And there's a process for doing that. We have a letter, that the form that the person can use. But in order to get the evaluation started, the school has a form that has check boxes on it for academic observation, behavioral testing, psychological testing, and that's done by the school psychologist. And under the regulations, the school has 60 days to complete that. And then at the end of 60 days, there's a meeting called the evaluation meeting, and it's discussed as to whether the child qualifies. And one of the categories is called other health impairment. And so somebody with a ADD or attention deficit hyperactivity disorder may qualify under that category, but that category also requires that there be a medical diagnosis from a doctor of that condition. And it can be anxiety, or it can be depression. Testing also would indicate whether there's a learning disability in one of the major core subjects. So then that starts the whole process with, if they qualify, then the IEP. If they don't qualify, and this example of the ADHD, they might still be entitled to get what we call a 504 plan. A 504 plan is the section referred to in the Rehabilitation Act of, I believe, 1973. Might be 75, but there's only one act.
One of those.
And that particular provision requires, it's a non-discriminatory provision that requires a student with disabilities to have equal access to the school program, the school curriculum that their peers are entitled to. The qualification for the 504 plan is that you have a mental or physical disorder that significantly affects a life activity. And so in this setting, in the education setting, what we're talking about is concentrating, thinking. I mean, it can also refer to somebody that has asthma and a breathing problem, and that they're entitled to accommodations. So if somebody has ADHD and they don't have a doctor's diagnosis for it, but it's obvious that, you know, they're having trouble and they're distracted, a 504 plan might help them with accommodations to get through that. You know, whether they need breaks, whether they need to sit closer to the teacher so the teacher can, you know, kind of have a signal when they need a break, or, you know, just
Yeah, and that's
that type of thing. But from an accommodation standpoint, in the IEP they have supplemental aids and services, which are accommodations and modifications. You can almost get the same accommodations in both a 504 plan and an IEP, but the IEP under the special education law has you have a better method of tracking it and keeping track of it. And if you have a problem, there's a procedural process to
So
follow. 504 is not quite as
not as much-
procedurally
not as many-
tight. I guess
Not
would
as
be
much teeth to it as the lawyers might say.
that would be a better way to put it. If I have time, just a quick example.
Yeah.
Somebody's having a problem with the math teacher in middle school, and they're under an IEP. Well, they can require that the math teacher be there and address the issue. Under a 504, the math teacher doesn't have to be there. I mean, best practice is to be there, but that's one example of the problem. But if it works, the accommodations work. I mean, it's another way. It's another way to get an education.
It sounds like there's quite a bit of flexibility in the rules and the process in order to give as much assistance as possible, regardless of the disability or the physical lack of a disability.
I think there is. I think part of our job at MEC is to make sure the parents are aware of that.
Yes.
That-
Well, hopefully there'll be viewers watching this that will become more knowledgeable of the center.
Yeah, and yeah, we're coming down to the final minutes here. So, Tom, if you wanna, the website is montanaempowermentcenter.org,
Correct.
and the phone number is 877-870-1190. If you need to
Yes.
reach out to the Montana Empowerment Center. And again, at LIFT, we do have our mandate to provide services that promote independence and accessibility for all people with disabilities. So if you're watching this and you might think that LIFT might be able to give you a hand, you can reach out to us at liftt.org and or at 406-259-5181. I'd like to thank Kathleen for being the co-host today, and for Tom Lynaugh for being here. And again, I know LIFT and MEP or MEC have worked together in the past and will continue to do so in the future. Thank you, Tom.
You bet.
Thanks, Jed.